So I want to welcome everybody to the joint meeting for the Rules and Open Government Committee and Committee of the Whole. Tony, can you take roll call, please?
Arenas,
Here.
Cohen,
Here.
Davis,
Here.
Perales,
Here.
Jones.
Present.
Thank you.
Okay, we're going to start out with the agenda for Tuesday, April 20th. And we are going to start at pages 4 and 5. Six and 7. Eight and 9. Ten and 11. And that is it. I'm going to go to the public. See if we have any public comments. And yes, Blair, go ahead. Go ahead, Blair.
Hi, it just unmuted, just gave me the mute capabilities. Hi, Blair Beekman here. Thanks for the meeting yesterday. You know, I'm learning a lot about water rate issues. It's complex. It's more than just possibly, you know, subsidy ideas. I hope my subsidy ideas can at least offer some sort of help and guidelines about, you know, the overall questions that they're vast and many. Good luck on how you can work on this issue, or on the water rate issues and the other rate issues of San Jose too. I wanted to quickly mention you have a drop item about immigration issues and the Office of Immigration, and that was at the Neighborhood Services last week, and I think they're going to work on it. It's going to come back, you know, sometime soon. You know, hopefully by May. You know, it's my hope. I figured I would give it one more real try here to mention the importance in all that in that work of, you know, having a good Zoom channel open to having different interpretations available. I hope you guys continue to work on that, because I'm very worried there's an English only issue involved with why it's been so complicated and expensive for this process to take place. And I think we need to address that. I think that, you know, the idea of having as many people and as many languages as possible into the community, you know, meeting process is just, it's a decent thing to do. It offers economic opportunity for all parts of different communities. And more importantly, it just offers good mental health and good community practices. And we need to learn to get out of that English only mentality. And it takes effort and work. And I hope we can do that. And I've explained ways we can do that earlier. Good luck in your efforts. Thank you.
Thank you. Alina?
Hi, my name is Alina Yin. My parents came here from Cambodia as war refugees. They have been here for over 35 years and are proud American citizens. They love this country. In Cambodia, there is no such thing as community engagement. The law is written behind closed doors, and you do as you're told, or you stand to suffer grave consequences. However,
Alina, sorry for interrupting. Is this referring to an item on
yes, it is.
which
It's
item?
for the so I believe it's item 2 for the consent calendar for the language translation services for the Charter Review Commission.
Got it. All right. Thank you. I'm sorry.
Okay.
Go ahead. Alina, we lost you. Let's move her back
Okay.
up. And
There, can you hear me now?
yes, and if we can give her some more time too. Thank you.
Thank you.
Sorry about that.
That's okay. Thank you. However, civic engagement and civic participation is in America is a celebrated cornerstone of our democracy. And my parents would love to participate locally, but they can't, because even though their English is proficient, they would need language translation services to enable them to fully participate with the confidence. And I unfortunately don't speak Khmer well enough anymore to translate for them. My parents are so smart. They are resilient, and they would be an invaluable voice to this conversation. Investing in language translation services also signals something. It signals we care. We want to hear from you, and because what you have to say matters. While I have no expectations that I'll see the Khmer language as an option anytime soon, since we are such a minority here, but the Spanish and Vietnamese speakers are not a minority, and like all of us, they do deserve to be able to civically participate in something as momentous as amending our city constitution. And I'm here to ask you to send this to council for a vote for an urgent solution. Akon, and that means thank you in Khmer.
Thank you. Christina,
Hi, can you hear me?
loud and clear.
Okay, perfect. Hi, I'm Christina Johnson. I am a commissioner with the Charter Review Commission. I am speaking in support of, of the Charter Review agenda item, asking for additional financial resources. We have an opportunity to really make the political process for City of San Jose inclusive and equitable. And, you know, I think it's best that we have the resources for the commission to be able to set out to do what we want to achieve, which is come back with a report that has all community participation and voice. And we can only do that if we're provided with adequate resources. My fellow commissioner, Commissioner Matsumura, did a memo at our last meeting that looked into other cities who are also doing their charter reviews, and they were provided with additional funding and staff support to do the best job that they can. And that's what I'm speaking in support of today. So I hope that that the Rules Committee will approve this, and that we will have further support of the council so that we can get what we need in order to accomplish what you've asked us to do successfully. Thank you.
Thank you. All right, that's all the public comments. Bringing it back to my colleagues, and we also have an ad sheet as well. Councilmember Davis.
Thank you. I will move approval of the agenda with the ad sheet and with a drop for item 8.1. This is the nomination of the Alameda Park Shealy Avenue Historic District. I spoke with the neighbors, and the neighborhood, of course, recognizes the history of discriminatory housing practices in our city and across the nation, and we want to make sure that we are taking the extra time to ensure that the historic designation doesn't perpetuate that issue, because of course we are committed to racial equality, so we need some more time to have those community conversations. And I've already reached out to Reverend Moore from the NAACP, and he's happy to assist us with that conversation. So that's my motion. Thank you.
Second.
All right, it's been moved and seconded. And I see Councilmember Moranis has her hand up. Go ahead, Councilmember.
Thank you so much. I just want to say thank you to Councilmember Davis for making that consideration, and for the neighbors also recognizing the history behind San Jose. I just want to thank you.
All right.
Welcome.
All right, Tony, on that note.
Arenas,
Yes.
Cohen,
Aye.
Davis,
Aye.
Peralez,
Aye.
Jones.
Aye.
Thank you.
Okay, moving on to the agenda for Tuesday, April 27th. Starting out on pages 4 and 5. Six and 7. And as you can see on page 7, we have return together. So just want to make note of that in case we want to have a time certain on that item. Pages 8 and 9. Pages 10 and 11. And page 12. So I am going to go to the public, and I have 2 speakers. First one is Blair. Go ahead, Blair.
Hi, Blair Beekman here. Thank you for these items on this agenda. I guess another thank you for just patience to me working out my COVID issues and how to talk about COVID. I mean, I'm really trying to figure out what can be sustainable ideas and how do we build a new era of sustainability out of COVID. And so thanks for your patience with that. I guess it's important to mention, I haven't heard too much about the COVID variant, like if it's on a massive growth level at this time. It may not be, which is a good sign. And so I still think we have to be cautious into May, and then May we can start to really understand how the vaccine process is going and stuff like that. I still hope we can make clear, if applicable, you know, are there aerosol vaccines being used in our school systems and hotels and restaurants and other places, and in the HVAC systems? Can we ask about those things, and can it be kind of like a safe place to ask? I mean, I'm not sure, I'm not certain, but just going to be that it can be a safe topic to ask about. I think it takes some effort, and I'm trying to make that a safe process. And it may or may not, but just to be sure. And I guess that's about it for now. I guess how much time do I have left here? I have 20 seconds. I guess I'm trying to learn, how to say that, as always, our first steps out of COVID, out of this era of COVID, really needs to consider what is our positive sustainability and how we don't have to hurt ourselves in the future to create our better practices and our better society. Thank you.
Thank you. Call in user 1.
Yeah, hi, Martha O'Connell speaking, pleading for a time certain for the return together early in the evening. And I feel like a broken record because I've been talking about this for over 15 years. Please talk less and listen more. And this is a very critical topic. And I'm sure seniors, disabled, people who have to get up early in the morning, and people that have to take care of their kids would appreciate an early time certain. Talk less, listen more. Thank you.
Thank you, Martha. Bringing it back to the committee, Councilmember Perales.
Yeah, I would have a suggestion of maybe time certain at 4 p.m. for that item. I know it's earlier in the agenda. I think that might help too with our translators to give them a time certain. But I know we have another stab at this next week, so maybe I'll make that a suggestion at the moment, and then I'll make a formal time certain request next week.
Okay.
So for now, I'll move approval of the April 27th agenda.
Second.
All right. It's been moved and seconded. Tony?
Arenas,
Yes.
Cohen,
Aye.
Davis,
Aye.
Perales,
Aye.
Jones.
Aye.
Thank you.
Okay, next up is B1, review the April 23rd, 2021 final pension obligation financing option study session agenda. Well, that's a mouthful. All right, let's see. No public speakers. Bring it back to the committee for a motion.
I'll move to approve the agenda.
I'll second.
Great, thank you. All right, it's been moved and seconded. Tony?
Arenas,
Yes.
Cohen,
Aye.
Davis,
Aye.
Perales,
Aye.
Jones.
Aye.
Thank you.
Okay, next up is item E, the public record. I don't see any public speakers, and Councilmember Perales, so your hand has been up. I was assuming it was for the agenda items, but if you wanted to go ahead and make the motion, or one of my other colleagues.
Motion to note and file.
Thank you.
Second.
Thank you. To move and seconded, Tony?
Arenas,
Yes.
Cohen,
Aye.
Davis,
Aye.
Perales,
Aye.
Jones.
Aye.
Thank you.
Okay, on to the Gs, the consent calendar. And we have a member of the public who would like to speak, Blair Beekman.
Hi, Blair Beekman here. On to the G's. Thanks. Those are nice words. Yeah, for the consent calendar items, that you have another dumpster day that on your council agendas. Thank you. And I just wanted to make light of it and note it. And just once again remind it's a real good chance for all parts of a community to gather together on a Saturday morning and just learn to talk to each other. And I think it's a really interesting day, and it can offer a real interesting experience for all parts of the community. To understand their issues and want to work on the things within a local neighborhood. And people with homes can address people without homes, and people without homes can address people in homes, and it's working each other's issues out, or with homes, I guess. And I guess to note that Paul Pereira, the mayor's aide, he works on this stuff a lot. And for both homeless, houseless, and people with homes, just to mention, Paul can be a good person to talk to as a good go-between, to help sort out and maybe work as a third party in whatever neighborhood issues you're working on. So thanks a lot again to city staff for bringing these items on the council agenda each week, and I hope they can continue to do so, and it just becomes familiar and enjoyable and just good community practices for us. So thank you.
Great, thank you. Bringing it back to the committee. Oh, I'm sorry, we have another public comment. Elena, Alina.
Alina, thank you. I just wanted to speak again on, I believe now it's the item 21-405 for the language translation services. I think that it would be really important to have them for the City Charter Review Commission. And when I think about this impact is, we could have multi-generational participation in this process if people who don't speak English as a first language could also participate in the process. And also want to speak in support of item 21-410 for the Bill of Rights for the children and youth. And that's it. Thank you.
Thank you, Jessica.
Hi, my name is actually Daniela. Sorry, I was using the wrong Zoom account. I am here to talk about making sure that we have translation services for our charter commission. It is very important. My grandma is 76 years old and she recently became a US citizen. She has always been civically engaged in her home country as well as here. And I would like for her to have the opportunity for her voice to be heard, and as well as other members of our communities whose stories and voices are not heard because of the language barrier. We have a very diverse community, and I think it's important that we also hear what they have to say so that they can contribute to our community, and that these decisions that affect our most vulnerable, they should at least get a say in what these decisions are being made. So I strongly encourage you to make translation services a priority, so that we're not having to come up with these discussions of we don't have money, and it should just be a given that translation services are needed in every aspect of community engagement moving forward. Thank you.
Thank you, and you actually spoke on the item that's coming up, but since it's the next item, thought to let you go ahead and finish your thought, but that item is coming up next. All right, bringing it back to the committee. If I can get a motion, please.
Move approval.
Second.
All right, it's been moved and seconded. And
Arenas,
Yes.
Cohen,
Aye.
Davis,
Aye.
Peralez,
Aye.
Jones.
aye.
Thank you.
Chair, if I could, I was just going to make a mention of something if I could.
Sure.
Yeah, you mentioned already, but I think that we had two speakers that spoke on this next item already. So just out of fairness of those that are participating, I think just to note that they've commented on this next item. I think just a little bit out of line because I don't know if they were fully aware that we hadn't gotten to the item yet.
Yes, thank you. Appreciate it. All right, well, we are at that item, request for additional financial resources allocated by the San Jose City Council to the Charter Review Commission. We're gonna go to the public now. As my colleague, Councilmember Pauls has already stated, if you've already commented on this item, there's no need to comment again on it. So going to Blair Beekman. Go ahead, Blair.
Hi, thank you, Blair Beekman. Thanks a lot for the words from the previous two speakers. Boy, it's just, it's nice to hear. You know, I've been trying to offer, you know, my help to the situation and the money issues involved, and that Zoom is so expensive to do this process. I think there can be ways, hopefully, to negotiate with, you know, local city government unions to, you know, bring down the price, you know, from 300 to say $100. I think there could be a lot of enthusiasm. I think this is an idea of enthusiasm, and then if we get enough enthusiasm going, it can really accomplish a lot. You know, you could contact city government workers who I think would want to do this. San Jose State students, I think, would be more than happy to interpret for $100 an hour compared to $300. I think they'd be just as happy with $100 an hour. And it's a matter of negotiating that and learning to get over some long time hurdles that I hope we're really trying to practice and work on. Yeah, and we can develop, you know, there's ideas of, I use the embarrassing term, economic opportunity. I mean, it's economic opportunity and development for a whole city if you do these sort of things, and that creates really interesting mental health. And my own personal way to work is through mental health. I think it would just bring a much better mental health through the city. And but you know, there's nothing but good if you offer these practices. To mention the charter process itself, thank you for the work of thinking about city council and community and its relationship to the city manager before the mayor, working with development agencies. Thank you.
Thank you, Jeffrey.
Members of the Rule Committee, Mr. Vice Mayor, on behalf of Working Partnerships, would like to support the request in front of you in terms of bringing to City Council a discussion of allowing some additional budget, both for supporting the civic engagement strategies that are outlined in the memo. Additionally, I think as we talked about last time, this was before the Rules Committee. Historically, in past charter review commissions and also in other similar charter review commissions we've engaged with in other cities, it's a common practice to be able to secure outside counsel just to ensure that, in fact, the commission has access to independent legal services to be able to aid in drafting what proposals the commission does come up with. We think that, you know, these two legs of ensuring resources for the kind of robust civic engagement at a time when, you know, civic engagement is generally tough for the city in this kind of Zoom world, but I think it will be even more challenging in helping members of the community dig in on what I think for the layperson is rather difficult to dig into about the city charter and its implications. But we've seen strategies that the city has taken very complicated planning processes, and by engaging community partners has found ways to really socialize some of these tough questions and to bring in audiences that otherwise may not have had a chance to weigh in on really important topics. And we know, you know, that this commission was created by an outpouring of public interest in the process of how we reshape our governance. And so hopefully you'll prioritize this, send it to council, provide the resources it needs to be able to move forward. Thank you so much.
Thank you. Jeremy? I think we lost him. Veronica? Go ahead, Veronica.
Great. Hi, everyone, and thank you so much. And thank you to the previous speakers. I'm also here in support of this much needed aid for the charter review. I think the charter review, one of their missions is to examine how to be inclusive and in diversity as well, right? And so we can be as a charter review, it can be exclusive by not offering this translation support. More than ever, I think our communities are engaging and want to know more and want to learn, and it is essential that as the government is able to provide that, nonprofits and other organizations are able to do it. Why isn't our government able to do that? As well as with legal counsel, I think it's important to provide that. I felt like the charter review was already kind of set up with no resources whatsoever and already ready to fail. And unfortunately, that's not what we want to see. We want to make sure that anything that we put out there as a government, as a city, we are supporting it. The same words that we use, equity, inclusion, diversity, that we are putting our funds to that and not just our words. Thank you so much.
Thank you. Jeremy? Did we get you this time? Go ahead.
Thank you, Vice Mayor Jones, members of the Rules Committee. My name is Jeremy Barus, and I'm very honored to serve as a commissioner on the Charter Review Commission. And we will be making recommendations to council later this fall that will have a lasting impact on our city and its residents. That is why we must make an investment in a robust process to make sure that we're including as many community voices as possible. That is why that it's imperative that we invest in outside counsel, funding for our research analysts, investing in our local CBOs who serve as trusted messengers to the community, and translation. So I do ask that Rules Committee please support the motion to send this discussion to council for a full vote as an urgent solution to funding our Charter Review Commission. Thank you.
Thank you. Brenda?
Hi, good afternoon, Council men and women, Mayor. I'm here to support additional finance resources for the Charter Review Commission. The Charter Review Commission was established to examine the city's governance structure and solicit community input, which I think is the key thing here. We want community input, and we want to make sure that this charter is able to make the best recommendations they can make to City Council. This was the initial reason why this was formed, to support a lot of the decisions for the strong mayor and other potential charter reforms. So I'm here to urge you guys to support this. I think it's needed, and I think that these funds will help in many ways, not only to provide translators and other things that will help them make these decisions, right, that are hard for City Council members to make, but now they have recommendations that will help them and guide them how to make these changes that our city needs. So I urge you guys to please support this, and you guys have a wonderful day. Thank you.
Thank you. That's all the public comments. Bringing it back to the committee, Councilmember Arenas.
Thank you, Chair. Well, first of all, I just want to thank everyone for calling in and really putting this in front of the Rules Committee by submitting it into public comment in form of a letter. I know that Tony has submitted a supplemental memo that was actually in March, recognizing the need for additional resources. And so I wanted to ask, Tony, if you're available, what the next steps are in order to secure some funding. I know that it has to come out of the city clerk non-personnel budget based on your memo.
Right.
But if you could help outline what the next steps are.
Well, the next step is, like, you guys can't make the approval. It would have to go to council for council discussion and for council to approve. That's like the next step. That's the main decision you have today, is think this has enough merit to go to full council for discussion. And then we would like, I can answer some of the questions that you might have about how to go about getting a research person and interpretation and those kind of costs. I can answer those questions today, but the main step is, do you think this is worth going to council for a full discussion?
Yes, I do. But before we move to that next step, I want to just get a commitment from our city manager's office. Lee, I don't know if you're prepared to share any level of commitment for finding funding for this.
Yeah, so thank you, Council Member Lee Wilcox, Deputy City Manager. I'm not seeing Jim Shannon, our Budget Director, on yet. But as this moving forward, the City Manager's Budget Office would do analysis to find any savings within the current budget cycle to offer those up as possible funding sources for this work if the full council wish to grant these resources. So that is analysis that we can commit to and we would do as this move forward to council.
Perfect. And thank you for that. So I'm going to make a motion to move this to a council discussion as soon as possible so that we can figure out with our budget analysis how we can help secure some of this additional funding that our commissioners are advocating for.
I'll second, but I will ask if we could get a date from staff when they think we might be able to hear back from you. Bye.
I could go next week. I'm not sure about city manager's office.
I think the memorandum from Councilmember Arenas recommends April 27. And because we are in the production cycle of the next budget, I would ask for that flexibility for the 2 weeks so that Jim, who has just joined us in the budget office, can have time to look at that. So I would recommend April 27th.
And Jim, does that give you enough time? Is that reasonable? And I'll put reasonable in quotation marks.
Hi, folks. Jim Shannon, City's Budget Director. And I assume that is a finding resources in the current budget year for the commission?
Right.
Yeah.
Wonderful. Well, you are on record, Jim. So wonderful. Does that satisfy Councilmember Perales?
Yeah, I think we just to make it clear, yeah, we got the 27th. We'll be coming back. Thanks.
Perfect.
Great. So we have the commission chair Furrer, who would like to say a few words. Chair, before you start though, don't snatch defeat from the jaws of victory.
I'm just here to say thank you for your support and appreciate the move on. If you have any questions, I'm happy to answer them, but that's all I have to say. And thanks my fellow commissioners for their support today.
Fantastic. All right. We have a motion and a second. Tony?
Chair,
Yes.
I'm so sorry, Chair. Could I just, I do want to take a moment just to thank my own commissioner from District 8, Jeremy Bruce, who has been advocating for this, as well as our chair who's present here for his advocacy, and for all the public who's called in and taken the time to actually do this on a Wednesday afternoon, because they believe in our government and how important it is to provide all of these additional resources. So thank you.
All right. So Tony?
Arenas?
Yes.
Cohen? Davis?
Aye, sorry.
Got it. Davis?
Aye.
Perales?
Aye.
Jones?
Aye.
Thank you.
All right, next item is Bill of Rights for Children and Youth. I don't see any public speakers, so bringing it back to the committee. Actually, just saw a hand raised. Blair, go ahead.
Hi, thank you. Thank you for noticing my hand raised. I just wanted to quickly offer that I haven't looked over this item too much, but I'm guessing that Human Services Commission had a big part in its process, and it seemed like it'd be the appropriate time to just thank them for their, continuous good work, and thank you for this item.
All right. Bringing it back to the committee. Any comments or motion? Councilmember Reyes, I don't know if your hand is still up from the last item or.
It was, but it serves me for this item too.
Okay, go ahead.
Wonderful, thank you. So I wanted to thank our youth commissioners for taking the time to review their Bill of Rights, which I mentioned last week to our committee that was approved about 10 years ago. And so they've done quite a bit of work in some of the articles within the Bill of Rights. And just to give you a bit of a sneak peek into what they've been doing, I'll just read one of those articles, and that is that Article 3, they have access to a 21st century education that promotes success in life and future careers, and a lifelong and a love for lifelong learning. And their addition was to include digital inclusion. So it's these kinds of efforts that they are making sure that we update to Bill of Rights. Before, we might have not seen the importance of digital inclusion. Well, it was of course a priority for the city, but it was slow turns in terms of progress. And because of the pandemic, it is absolutely essential. And so they've done the work to update many of these Bill of Rights, and actually adding one additional one. And let me just read that one, because that one's a new article that they have added, and they have knowledge of, and when they say they, of course, they mean children and youth, are educated about and actively include people of diverse cultural, racial, ethnic, socioeconomic, and religious backgrounds, as well as all genders, gender identity, sexual orientation, citizenship, developmental abilities, and are aware of the importance of inclusivity and identity. And so that just gives you a bit of an insight in terms of what our youth are thinking about and how important it is to integrate this into our present government. So I want to make a motion to cross reference this to our council.
Second.
Second.
All right, it's been moved and seconded. Thank you for that, Councilmember Reyes. As long as there's nothing in there that says that they have the right to stay on their parents' mobile plan, I can support this.
That is implicit, Chair. They don't even have to write it in.
Okay, I appreciate that. Tony?
Arenas,
Yes.
Cohen,
Aye.
Davis,
Aye.
Peralez,
Aye.
Jones.
Aye. Okay, next item is the Assembly Bill 1400, Guaranteed Health Care for All. And we're going to go to the public comments first. First speaker is Blair. Go ahead, Blair.
Hi, thank you. I had read the previous agenda item and knew that the Youth Services Commission would, had done work on it. And, I just wanted to remind from Councilperson Arenas' nice words that, their good work with the item and digital inclusion ideas. I hope they can remember how to think about and include open public policies in the future ideas of digital inclusion. I think that could be really interesting, innovative work for themselves, and I hope they're figuring that. Yeah, I just wanted to quickly offer that. With that being said, to speak on this item, for this item, I really, pre-COVID-19, the idea of healthcare for all in San Jose, I mean, I used to talk about workers' rights, housing rights, open public policy ideas. Those were three biggies among other ideas, or four, I guess that is: human rights, housing rights, worker rights, and open public policy ideas. There was a bunch of items that we're really building towards our future sustainability of a society and as local communities. And healthcare for all was a really important part of that process in San Jose. And I was so incredibly hopeful about how to define the future of, real genuine positive sustainability that I feel healthcare for all is really a part of and can help offer. And so, I thank you for that. I am still hopeful. We're trying to figure out, we created a mess with the era of 9/11. I think since 2014, this country has been really trying to apologize for that time and build something really important and meaningful and peaceful since then. And we have to continue those good efforts, and we won't have COVIDs in the future. Thank you.
Thank you. Mimi?
Hi, thank you for taking my call. Can you hear me? Okay.
Loud and clear.
Thank you. Thank you so much. My name is Mimi Spreadbury. I live in North San Jose in David Cohen's district, and I'm a member of Orchard City Indivisible. COVID-19 has laid bare the great health inequities in our country, especially here in San Jose. It was really shocking that our county was at one point the epicenter for COVID-19. And we do know now that there very likely will need to be booster shots to the vaccines, that our long hauler COVID patients are going to need continued care for the rest of our lives. So for health equity, for our communities of color, our beloved communities, BIPOC communities, please consider this resolution to better support them and to support better equity after COVID-19. So please do pass this resolution put forward by Leader Peter Ortiz. Thank you so much. I yield my time.
Thank you. Brenda?
Hi, hi everyone in the Rules Committee. My name is Brenda Sendejas. I am from District 5, where our wonderful Councilmember Carrasco represents. Today I call to urge you to support AB 1400 that will guarantee healthcare for all. The single-payer healthcare is a universal healthcare that will cover all residents. We saw the inequities in our healthcare with the pandemic. Currently, our healthcare finance structure is made up of an incredibly complicated network of multiple payers that involves both private and government health insurance options. This still doesn't cover all. Our community residents' life expectancy is at the lowest. This is alarming. If you want to grow old and see your grandkids, this is scary to find out that our life expectancy keeps going down. This will not only improve and expand healthcare for all, but ensure that people no longer have to choose between healthcare, paying rent, bills, or childcare. There is about more than half of American physicians that support Medicare for all. I know that when we have insurance, we don't worry about these things. But for example, your positions right now, they're temporary. You're covered, you're fully covered. But when you're no longer in these positions and you have to find a good plan for your family, oftentimes you have to think about the cost and you have to make hard decisions. Let's end this and support AB 1400. Thank you.
Thank you. Peter? Go ahead, Peter.
Hello, can you hear me?
Loud and clear.
Thank you. Hello, honorable council members. My name is Peter Ortiz. I'm an East San Jose community leader and trustee for the Santa Clara County Board of Education. I want to thank my council member, Magdalena Carrasco, for bringing this important issue forward, as well as I want to thank the council members who have voiced support. There are a few intersectional issues that affect all communities today, like the need for universal health care. The COVID-19 pandemic has exposed our broken healthcare system that has left millions without reliable and affordable health coverage. Nowhere is this more of a reality than in working class neighborhoods and communities of color. Here in Santa Clara County, our Black, Latino, and undocumented community members have been hit the hardest by COVID-19. And this all is tied to a significant factor, which is the inability to access affordable health care. It's our responsibility as local activists and community leaders and elected officials to advocate for our state's under-resourced communities. We need to do everything in our power to make sure that healthcare universal coverage becomes a reality. AB 1400, authored by Assemblymember Kalra, would address the gaps in our system by effectively removing the private healthcare insurance and their capital incentives from the equation by shifting responsibility for administering and financing health coverages to our state government. It will also make sure that members of our precious undocumented community are fully covered. I humbly and respectfully ask our leadership to support the council members' memo and move forward to endorse AB 1400. Thank you.
Thank you. Next up is Brenda.
I'm sorry, I already spoke.
Yeah, I was gonna say, you're, next up is Lucy. Lucy, go ahead. Lucy? Let's go back to Lucy. Let's go to the number ending in 2301.
Can you hear me?
Loud and clear.
Yes. Good afternoon. My name is Salam Ajloni. I'm a member of the Democratic Socialists of America Silicon Valley chapter and of the Santa Clara County Single Payer Healthcare Coalition. I'm calling to speak in favor of the resolution in support of AB 1400. As every expert will tell you who studied this question, a publicly financed and single payer healthcare system that would cover everyone in California would save thousands of lives each year, would extend hundreds of thousands of lives each year, and for more than 90% of households and businesses, as well as for local and state governments, would save billions, tens of billions of dollars in healthcare premiums and costs. And just to give you some preview, we have in the COVID era a preview of what such healthcare might look like, and it's called the vaccination program, where everybody, it's universal, nobody's excluded. There's no payment or co-payment or premium to pay at the point of service. You go in, you show an ID, you get your service, and you're out. And we pay for it through our taxes. And it's simple, it's clean, it covers everybody, and the vaccination program is going to work as a result. And that's one example, of what a single payer healthcare system would be for everybody and for everything. It would cover everything, would cover everybody, and it's the least expensive, the most equitable way to address healthcare rights, healthcare justice, I should say, and healthcare, just healthcare of the population as a whole. And I hope you, the City Council of San Jose, will support Assembly Bill 1400, which seeks to achieve just what I just tried to explain in.
Thank you, sir. Veronica?
Great. Thank you, everyone. And thank you to everyone that has spoke before. I'm also here to endorse and push forward this bill, the 1400, guarantee healthcare for all, because it is not just a privilege, it is essential. It is essential from our babies that are being born to our oldest member in our community that needs it. I can only tell you that, again, many of my family members being undocumented and not having the ability to, being also essential workers working in grocery stores and not having the ability to pay for their own healthcare. One of my uncles almost lost his ear because he didn't have healthcare just a couple months ago and wouldn't want to go to the emergency room or see a doctor because he didn't have $200 to pay for an appointment. So what ended up happening was he ended up having a really bad infection where they almost cut out his ear. Now he's left with a $7,000 bill. Now making it on minimum wage as a grocery worker who has 2 children and a wife, how is he supposed to pay those extra $6,000 to $7,000 to the hospital? It is not only not fair, but it's unjust. He's also out there sacrificing his life during this pandemic to make sure that people have access to food, to make sure that people have access to groceries, to make sure that people have somebody opening those grocery stores. And again, his story, it's not an only story. It's not the first story. The stories have been going on over and over again, and we will keep seeing them until we actually until we become proactive and do something about it. I hope that you all start this with all of us and that we go beyond and supporting this guaranteed healthcare for all. Thank you.
Thank you. Zach?
I think I'm here. Hi, my name is Zach. Zach McDonough. I am a member of the Silicon Valley Democratic Socialists of America Healthcare Working Group. And I'd like to speak in support of AB 1400. This is an absolutely essential step in creating health equity and access and quality healthcare, both for California and for the country in general. Some of the principles that are guiding both the Medicare for All campaign federally and the AB 1400 campaign here at the state are built around these 5 principles. One is to create a public single healthcare program that ensures equal access to all medical services and treatments. Next is comprehensive coverage of all services requiring a medical professional. Next after that is the healthcare that is free at the point of service. That means no copays. Next is universal coverage for all United States, for all California residents and United States residents in the case of Medicare for All. And this includes non-citizens as well. And finally is a jobs initiative and severance for those that are affected by the transition to a public healthcare system from a private healthcare system. So just to speak to everybody's emphasis on our residents here that are immigrants, actually, in March of 2021, a study was published that in 2019, 1 in 4 low-income immigrant adults in California avoided public benefit programs, which likely worsened food insecurity and access to healthcare due to the push from the federal government around the public charge rule. So not only is this going to affect people's health in the short term, but it's going to affect the financial point or financial stability of the state government, having to cover all of these immense expenditures related to emergency care. Thank you.
Thank you. Next speaker, I'm just going to spell this out, Brogrem. You're next.
Hi, can you hear me?
Loud and clear.
Hi, my name's Riley Brand. I live in District 2. I am a father. I'm just calling as well in support for Assembly Bill 1400, the Guarantee Healthcare Act, and for y'all to get this on the agenda. I have had, personal experiences. I could speak, to what Medicare for All would do and what, Assembly Bill 1400 would do. I think plenty of people have done that to great length and with much higher eloquency than I could. But this would affect everyone and would truly, guarantee healthcare for the working class. And there's no other bill or no other proposal that does that. If you leave anything as far as barriers to care, as such, anything that has to do with cost is considered a barrier to care, then you're not actually, guaranteeing or universalizing healthcare. And only Medicare for All does that because it, removes all point of sale. There's no cost sharing by the individual, right? You don't have to go pay copays, deductibles, that sort of thing. But anyway, I just wanted to say, yeah, I'm here for support of that. father. You know, the one thing that's preventing me from buying a home in this moment in San Jose is paying off medical debt, right, and paying off student loans. And so if we could, you know, fix that for people, yeah, you know, the upward mobility would truly increase. And as a person of color, you know, I would be an example of that. So in any case, yeah, thank you all for your time and all you'll hear.
Thank you. Next up is Lucy.
Hello, can you hear me this time?
Loud and clear.
Oh, fantastic. Hey, thank you so much for having us all here today. And I'd like to thank the council members and your staff for the incredible work you do. You work very, very hard. I work as a part of several community groups, and I go out and talk to folks, and this issue is wildly popular. I've never seen such a hot button issue. And I do want to say that the lack of care for our people is unconscionable, especially in the richest nation in the history of the world. Polls say that 70% of Americans support a guaranteed health care for all. And when City Hall, right here at the grassroots, supports guaranteed health care for all, our leaders up the chain in business and in government will help us get this job done. That's why we really need your support. And what I'd like to say is I'd like to see one open enrollment date for everybody, and that's the day that a person is born. Cradle to grave health care for everybody. Please support this memorandum for AB 1400. Thank you very much.
Thank you. The person with the number ending 2582.
Hi, sorry, can you hear me?
Loud and clear.
Hi, my name is Kyle. I'm with the Silicon Valley Democratic Socialists of America and the Santa Clara County Single Payer Healthcare Coalition. I also want to strongly advocate for you all to endorse AB 1400 as well as organize around it. It is just beyond critical for as many people have already laid out, but especially for our elderly populations. A study from Stanford recently demonstrated that there's a significant uptick in people going to the doctor and the hospital once they qualify for Social Security and Medicare. And, you know, that results in a great strain in our emergency services, as a lot of health problems that could have been caught early have not been allowed to fester. And unfortunately, during the pandemic, a lot of our elderly populations have suffered, not just because of the COVID, but as well because of various health issues that have been festering. So I, again, strongly encourage you all to endorse it as well as really put an effort behind organizing behind it.
Thank you. The person BROGREGM.
Can you hear me?
Loud and clear.
Okay, great. In this wealthiest country in the world, where we spend twice as much per person as countries that guarantee health care for all their people and have better outcomes to show for it, we have by far the highest number of COVID cases and deaths. Even before the pandemic, we had 87 million or underinsured. A recent study by Public Citizen estimated that about 40% of US COVID-19 infections and 33% of virus deaths are associated with uninsurance. A rational and humane healthcare system would provide equitable healthcare access to all residents, would not inhibit access by charging fees at the very time the healthcare is needed, would not be tied to employment or immigration status, and would not be allowed to gouge patients with outrageous prices and bills. A single-payer Medicare for all system created at the state level by AB 1400 CalCare would provide health insurance to all residents, negotiate fair payment to providers and suppliers, and allow our focus to be on restoring, protecting, and improving health rather than subsidizing corporate profits. The new system would also be able to focus more effectively on meeting the needs of underserved communities. So I'm a registered nurse, I'm retired, and I really appreciate Assemblymember Carrasco submitting this memo to the council and hope that you will advance it to the full council. We need this so badly. It's just a disgrace. The type of healthcare that we have in this country for all the money that we put into it. So please move this memo forward so that we can support AB 1400. Thank you.
Thank you, Brian.
Hello. Thank you so much for the opportunity and for all the work that you do. I hope you can hear me okay. I'm on my phone.
Loud and clear.
Wonderful. So Brian Wheatley, retired teacher, union leader, and currently a school board member here in San Jose, and calling to support Councilmember Carrasco's memo around AB 1400 CalCare. It is so important that we're able to address the gaps in our system by effectively eliminating private health insurance and their for-profit incentives from the equation by shifting responsibility for administrating and financing health coverage to the state government, but also make sure that members of our undocumented community are fully covered. I mean, I was blessed being a teacher for 35 years to have my health care tied to my employment, but that's not fundamentally appropriate, since I believe healthcare is a human right that everyone should have access to. And you know, I'm a huge fan. You know all of this, but establishing a state insurance plan that would cover all California residents, regardless of employment, income, health status, marital status, or documentation status, is huge, including coverage for medically necessary services currently covered by the Affordable Health Care Act, plus oral health, audiology, vision services, and long-term care. All are hugely important. We've seen how our current system does not function with the reality of the COVID-19 pandemic. And we have a historic opportunity to change our system right here in California to lead the way for the nation. And I certainly hope that the city that I live in and have grown to love, I'm a transplant from New York City, will lead the way, as we often do right here in Silicon Valley. So thank you very much for the opportunity.
Thank you. Luca?
Hi, can you hear me?
Loud and clear.
Awesome. My name is Luca. I'm from Evergreen in Councilmember Arenas' district, and I'd just like to quickly speak in favor of AB 1400 getting on the agenda. So as we slowly emerge out of the pandemic, I think it's really important to keep in mind that the healthcare crisis isn't over, and it's nowhere close to being over. You know, the problems posed from our for-profit healthcare system still very much exist, and unless we take action to transition it into a system that actually meets the needs of regular everyday people, we'll continue to be at risk of a repeat in the disaster that was our country's pandemic management. I'd also like to reiterate a statement that's already been made many times by previous speakers. You know, that our country's healthcare crisis is disproportionately affecting marginalized groups, and if we want to begin to dismantle these racist and oppressive structures, AP 1400 is extremely essential. I'll yield my time.
Thank you. So that's all the public speakers. So before I bring it back to the committee, we have Omar Torres from Councilmember Carrasco's office, who's going to do an amazing job of advocating and making strong points on why we should support her memo. So how's that for a setup, Omar?
Well, thank you, Mr. Vice Mayor. Don't get me nervous here now, okay?
Okay.
Uncle Chappie Jones. All right. Good afternoon, everybody. My name is Omar Torres. I'm Deputy Chief of Staff for Councilmember Magdalena Carrasco, and she is very sorry that she couldn't be here today. However, I'm here on her behalf. Thank you for our community who is here to support AB 1400, especially her constituents in District 5 who brought this forward to her a couple weeks ago, and to Assembly members Ash Kalra, Alex Lee, and Miguel Santiago for authoring this bill. As of 2019, there are roughly 3 million fellow Californians who do not have health insurance. These numbers are only projected to rise because of COVID-19. Of those 3 million, 63% are members of our Latino community, and 300,000 are children, an injustice. We now have a chance to change that. The passage of CalCare would not only help provide affordable health insurance for the many uninsured people in our community, but would also save money for businesses, schools, and cities. CalCare streamlined the medical payment process, removing externalities and making the payment process simpler and more efficient for all parties involved. This lowers the overall cost of treatment, allowing CalCare to be affordable for all Californians. Because CalCare would cost less for businesses, schools, and local governments, then, sorry, let me go back to that one. Because CalCare would cost less, business, schools, and local governments will be incentivized to use CalCare to cover their employees rather than in-house insurance programs. It is estimated that will save the city of San Jose $100 million annually. 48% of Californians receive health insurance from their employer, meaning CalCare would cover a large part of our California population. The more people that use CalCare, the cheaper it will be, since providers generally lower cost when there are more people involved in an insurance program. This means that larger entities can provide cheaper healthcare. Because CalCare will immediately be the largest healthcare program in the state, it will be able to offer some of the lowest prices for those who most benefit. On a more personal note, we know that we are in the worst healthcare crisis in our lifetime. It is important for our city to support Medicare for all, especially for our undocumented community and indigenous communities as well. And I want to give a shout out also to the Students for a National Healthcare Program chapter, who continuously keep pushing us to make sure that everybody has the healthcare they deserve. So thank you so much, and I hope that many of you are able to pass this because Councilmember Carrasco deeply cares for her district, since many of her constituents are undocumented and are underinsured. So thank you very much.
Thank you. Councilmember Arenas.
Thank you. I want to just thank Councilmember Carrasco and Omar Torres for bringing this forward, and for all of the community who has expressed such support for this item. One of the things that I was thinking about, and actually Serena Alvarez, who wasn't on the call, but she sent in a letter, just changed my perspective about, not that I was not supporting this, but it just allowed me to appreciate the need for healthcare for all in a slightly different way. And that is the current lawsuit that is happening by Medi-Cal for the discrimination by Medi-Cal against Latinos. And as you all know, when you're a low-income family, you're likely to qualify for Medi-Cal, but if there aren't any medical providers that take Medi-Cal, then essentially you're being left out of that care. And so it is no good to have Medi-Cal in your wallet, in your purse, if there isn't a provider that will serve you. And one of the articles that she sent to all of us on council was somebody who was dealing with a chronic condition and had to wait for a whole year for an appointment from a specialist, a neurologist. And it really just, drives the point for this item, which I'm going to support. And I'll make a motion for us to move forward with this item to full council so we can have a resolution in support for this. I think a lot of the speakers said, and I think Omar, you said it as well, and that is that this pandemic has showed us how fragile our low income and immigrant communities have been, and they've been fragile to getting sick and having medical costs just overwhelm them with debt long before the pandemic came along. But this pandemic has driven this point to a degree that it's cruel and very unforgiving, because it's ultimately has led to many deaths, especially of those in the Latino community in this county. And so with that, I'll just close up and say thank you to all of those folks who called in. Thank you for creating this awareness. Thank you for your advocacy and for your voices. And we hope to hear you as well if this gets cross-referenced to our council.
Thank you. Councilmember Perales.
Yeah, thank you. I'll turn my camera back on here. Thank you. Appreciate the public speakers that came out on this, and I'm aware and familiar with some of the past efforts in this regard, and I think in the challenge that our state legislators are going to have in being able to move this forward. But I think the support is going to be important, and certainly being able to move in this direction, I think California has a great opportunity to be able to do so, albeit certainly lots of challenges ahead, but would be happy to be able to lend our city's support in this effort. So I'll be supporting it. Thank you.
Councilman Perales, would you provide me with a second on my motion?
Oh, I'm sorry. I did not catch that. That did not get seconded.
It
Yes.
was a really long motion, sorry.
Yes.
All right, we have the motion in a second. Are you done, Councilmember Perales?
Yep, that's it. Thank you.
All right, Councilmember Cohen.
Yeah, thank you. And I want to thank all of the members of the public who came and spoke so eloquently about the importance of this legislation and why it's great for our community and for the state. Single-payer healthcare is long overdue. I've been advocating for over a decade, and I'm glad to see we might have some traction to get it done this year. It's not just good policy because it's good public health policy, but it's also good economics. And so I'll be excited to vote to move this to council and look forward to a good discussion about it at the council meeting when it comes forward in a couple weeks. That's it. Thanks.
All right, thank you, Councilmember. I would actually like to hear from staff. Alexandria, would you like to weigh in on this proposal?
Sure. So yeah, staff has actually looked at this bill, and one of the things we're sort of recommending, and I think others have mentioned that there is sort of a hard road ahead for this, and we definitely support the merits of this bill, but we really do want to see where it goes. We support ensuring guaranteed health care for all. We know that that's very important, but there's a lot of unknowns, particularly in terms of how it's going to be paid for, what the cost is going to be. We know that a lot of this is going to have to be worked out in the budget discussions that are going to be coming up in the next few months. So hopefully, there will be more information available on this if it goes to council. So if it's referenced to council, we'll have some more details on this and sort of the path forward for the bill.
Okay, because I'm trying to get a better understanding of what we're actually approving. Because from what I understand and have read, is more of a concept than an actual bill because there's so many elements that aren't there. So help me understand exactly if it goes to council, what we're doing. Are we just making a statement of supporting the concept?
Yeah.
Help me understand exactly what we're actually doing.
I'm happy to jump in there.
Thank you,
Vice Mayor, and Alexandria can help me if I get it wrong. One of the things that the state legislature often does when they introduce bills is, 50% of it is written and the other 50% really gets worked out in committee. And this is one of those things where a lot of the details would be worked out through the committee process if it is granted. So I think what you're approving today is simply moving it forward to council. I think when we decide to hear it at council, it's a matter of timing on what you would be doing or not. If you wanted to simply, I think like Councilmember Perales mentioned, kind of lend our name and support and put on record, in the next week or two, we would probably be kind of supporting the concept or supporting the actual policy goal of healthcare for all versus, in a few months, once there's additional details there and Alex and her team had the benefit of providing you with more details, you might be taking a support position with those additional details. So I think it's more of a matter of timing of when it comes forward to council and what we can provide to you. But again, as Councilmember Perales mentioned, this does have an uphill battle through the budget process, and it doesn't have a committee hearing to date. So it's probably much more of a supporting a policy objective of the state, and the city lending its name to that at this juncture.
Great. Thank you, Lee. Councilmember Cohen, I see you have your hand raised again.
Yeah, I just also wanted to weigh in on that because I had a lengthy conversation with Assemblyman Kalra just a couple weeks ago to ask him some of the questions you just asked about the specifics of the bill. And it is a 400-page bill which lays out some of the details of what it would look like once we get to single-payer healthcare in California, but there's a lot of things that have to be worked out on how you get there. And as I said to him, getting from A to B is the hard part. He said, actually, it's more like getting from A to Z. It is a complex process. The expectation, I think, of his bill is this bill would start some things moving to try to then have future bills that would come forward in future years to lay out the details, the funding mechanism, the transition. So this bill is somewhat aspirational, but also does have specifics of what single-payer healthcare would look like. But I don't believe that the intention is that this bill would immediately implement single-payer healthcare, and there would be more things to do after that. So I just thought that context might help a little bit.
No, it definitely does. Thank you for that. All right, I don't see other hands raised. We have a motion and a second. Tony?
Arenas,
Yes.
Cohen,
Aye.
Davis,
Aye.
Perales,
Aye.
Jones.
Aye.
Thank you.
Thank you. All right, next up is an update to the January 2021 to June 2021 Community and Economic Development Committee work plan. I see one hand raised. Paul, go ahead. Okay, I guess we lost him. All right, there's no other public speakers. Bring it back to the committee. Can I get a motion, please?
Motion to approve.
Thank you.
Second.
All right, it's been moved and seconded. Tony?
Arenas,
Yes.
Cohen,
Aye.
Davis,
Aye.
Perales,
Aye.
Jones.
Aye.
Thank you.
All right, on to open forum. Blair, go ahead.
Hi, thank you. Blair Beekman here. It was good to hear so many voices on a single payer system, and then that's back around in our thinking again. Like I said, pre-COVID-19, I was really working on things, a number of items I would mention that would address sustainability for the future of San Jose. I feel that, and I felt then, and I feel now, with the return of this issue, we're talking about real ideas of peace and positive sustainability for our future. And it's exciting, it's important work. And I feel that we can really address our future with these sort of items. And I think we can really address the future of issues of how we, plan our large-scale social planning ideas for the future that don't harm each other. We don't have to harm each other anymore. We can really work on big issues out of this COVID era. And it's important we do that. We can't allow this COVID pandemic to happen again. I think it's important, my own personal feeling is we don't simply blame China. We look at a larger view that there were many players at the international level who could have had a part in this pandemic. And that's how I try to talk about the issue. I do not singularly blame China. The UN could have helped out a lot. The US could have helped out a lot. And, many other countries had early parts in this process that we are trying to address. What the last item about single payer issues, there's a whole set of issues that we're developing a future of peace. And that needs to be looked at. And we can do some incredibly good work with that. And it's nice. I hope we're returning to those efforts, and hey, we can involve everyone, the whole world. Thank you.
All right. Thank you. That's it for public speakers. And so we are adjourned. Have a good